Addiction is often called a disease of isolation, and it isn't getting any better in the face of a COVID-19 pandemic. Many Americans feel more alone than ever, but that doesn't mean recovery is out of reach. Tonight I spoke with Dr. David Frenz. He specializes in addiction medicine at Telehealth, which offers a virtual lifeline to patients. Okay, Dr. Frenz, we'll start with the first question. What are you seeing right now in your addiction treatment programs at Telehealth during this pandemic?
The need for treatment has gone up. Many medical specialties have seen that care has gone down. Mental health has been stable. People have been seeking care, and in fact, there may be signals that they need more care than previously.
I wonder, too, if people maybe have addictions to different types of drugs. This has been so tough on them, so much stress. Are they maybe using it to cope again?
People use substances for various reasons, but chemical coping, numbing and avoiding distressing things is a common reason why people use substances.
Is there a certain demographic of people who are being most affected by this when it comes to addiction during the pandemic? Age groups, men or women?
It cuts across all demographics, men, women. The substances that are used may be different by demographic, but addiction affects all.
Was there any concerns right in the beginning of the pandemic, maybe when it comes to certain types of opioids, that people might become more dependent early on? Did it hit people harder at certain times of this year?
A big concern, honestly, has been counterfeit pills. And so when people can't get pills from doctors, pharmacies, legal sources, they'll use illicit sources. And a lot of the pills that are out there right now are counterfeit. The Drug Enforcement Administration actually issued a warning about 2 weeks ago for Minnesota that the volume of illicit counterfeit pills is way up.
It's something we were not anticipating, of course. How we're talking right now, we're talking with just digitally through Zoom. That's kind of where the medical field has gone a little bit with telemedicine. What role has that played in Minnesota over the past several months when it comes to addiction treatment?
Telehealth is perfect for addiction treatment. In fact, we were working on this at Alina for a year and a half. And so as early as February of 2019, because a lot of people in greater Minnesota could not access care, we were using telehealth to treat people for addiction that way. So when the pandemic came along, we were able to scale it up rapidly.
I imagine one of the biggest issues back then was just the distance people had to travel. I mean, now there really isn't at this point, right?
Right. I mean, it's been a real game changer. The Twin Cities is fairly resource rich, but when you look outside of the Twin Cities, it's actually pretty difficult to access high quality addiction care. So telehealth is a major game changer.
Is there a certain appeal for it for some people, or do some still maybe miss that face-to-face interaction and being able to talk one-on-one just in the same room as someone?
It's mixed. That's a great question. I would say that possibly older patients do like more traditional health care, whereas younger patients who are used to more digital care and other digital stuff, they adapt to do it quite rapidly.
And by adapting to it, do you think it maybe makes people more apt to continue, not miss their appointments and get that treatment when necessary?
Right, there's no transportation involved. They can seek care at flexible times. A lot of my patients are honestly working adults, and they will excuse themselves and maybe hop in their car. The car's not moving, and we'll do the encounter from their vehicle. They'll be just sitting in a car somewhere. Maybe it's the parking lot of where they work, or it's somewhere else, and it's super convenient.
Yeah, a nice private, quiet setting for that person to seek assistance. We've obviously been spending maybe a lot of time with our family members, our roommates now, because we've been inside so often. Maybe we're starting to notice some of their tendencies, maybe some of their habits, if that also includes addiction. So if we're seeing someone maybe abusing a substance, at what point do we intervene or suggest maybe professional help?
The essence of addiction is people are either distressed or impaired by substance use. And it can be subtle. By distress, I mean emotional issues. By impairment, I mean failing to do the things you would expect them to do. So if they're a student, they're not engaged or performing as you'd expect. If they're a working adult, they're again not engaged or working as you'd expect or to the quality they're up to. So any of these subtle signs, and if they're substance related, should lead to some sort of professional help.
How do you broach that topic? How do you, carefully navigate bringing that up? Because there's going to be a lot of emotions involved, whether that be family or a friend or a roommate. Is there a good way to maybe start that conversation?
You start with concern. So you don't necessarily point out the things that are bugging you or annoying you, the things that are likely to set them off. The way I do it professionally, and I think families can do this as well, you lead with, for your safety, because I'm concerned, I think we need to talk about these things, or I'd suggest you do these things. It's hard to argue with people who are loving and concerned.
Well, Dr. Frenz, thank you for this advice, highlighting an issue that's always been a problem for people, of course, being heightened by the pandemic, but the ways that we're working through it and getting people the help they need. Thank you again, Dr. Frenz.
My pleasure.
You'll find this interview and many more on WCCO.com. We'll be right back.